Hey, Dr. Tyler Williams at Pinecrest Dental. Thanks for checking out today's video. You're here because you've had some experience with bad dental work or aggressive dental work, or maybe you felt like you were overtreated, or what a lot of people find us for is they've had root canal after root canal, crown after crown, and they feel like all their back teeth, often many of their front teeth, have had so much work that they're falling apart and they're worried it's all going to crumble. And you're not alone, right? When you work in the dental profession, like I do, sometimes you'll have a dream that all of your teeth are falling out, or you've got all these cavities, or you have to get braces again. So, as you know, when you have a dream, often that feels very real. And so, myself, I haven't had implants yet, but I've had gum grafts, gum surgeries for receding gums. I've had braces as an adult. I've had root canals. I've had caps put on my teeth. I've had old dental work replaced. I've had sealants. So I haven't been through everything, and certainly I'm not whining. I'm just saying that I can literally feel your pain in a lot of these scenarios. And about 12 or 13 years ago, I revisited some studies that I had learned years prior about ways to save your teeth that are actually stronger than crowns, right? Now, a lot of people hear crown and think that's the strongest thing for your tooth, but it's not. And the first reason why is when you get a crown on your tooth, you have to amputate or grind away 60 to 70% of your tooth, your natural tooth on average. And that causes your underlying tooth to be weaker, more brittle, more subject to root canals and sensitivity and bacterial leakage. So we started implementing some alternative ways to improve your teeth by strengthening them rather than grinding them down or amputating them for crowns. So as a result, we transitioned to about 10 years ago where we don't even offer crowns in our office because we feel like crowns are over treating. If you think about if you had a toe that was infected and you had to lose a toe, or you had to have surgery on a toe, you wouldn't have your whole foot removed and get an artificial foot and say that now that foot is stronger than it was before, because it really wouldn't be the same. You want to just remove the damaged or infected or decayed parts of your toe, in this example, and replace or regenerate those and preserve everything else you can. So by adopting what we call the prism method, which is just a series of steps we've designed for bonding and enhancing your tooth, the prism method has allowed us to have way fewer root canals in our office. And I mean, probably 10% as many as we did, a 90% reduction in root canals. We hardly ever see them unless a tooth has already been damaged or infected to the point where maybe you waited too long, or a piece of your tooth broke, or some type of accident and the nerve's already injured, right? But aside from those, 90% of cases we can avoid the dreaded root canal. And the other problem with the root canal is as soon as you have a root canal, your tooth inside does not have feeling. So if there's an underlying problem, you won't even know until it's too late, and you often have to lose the tooth and get an implant. On the other side, we also help a lot of patients with implants for missing teeth. So the advantage with that is we're not biased. If you go to a one-size-fits-all or place that only does one kind of thing, often, as the saying goes, if all you have is a hammer, all you're going to see are nails. And you don't want to be seen as a nail. You want to be seen as an individual looking for some customized solutions, right? Now, we don't offer everything under the sun because we focus on what we're best at. But what we're best at is evaluating on a case-by-case basis to give you a customized plan of should you save your teeth, or should you replace your teeth, or should you do a hybrid of both, which is often the case as well. So make sure you find someone who can look at your mouth and your health comprehensively, not just as a set of teeth, or not just as one tooth that needs a crown or something replaced. So thanks for checking out this video, and we'll see you on the next one. Have a great day.